how to help whilst waiting for an ambulance. In the current climate, you may be waiting quite some time for an ambulance, unfortunately. And the key is to only call an ambulance when you really need one. So if you are looking after a casualty who is not breathing or who's struggling to breathe and they're sucking in their accessory muscles or they're making grunting noises when they're breathing, or they're not breathing normally, if they are severely injured or they have a possible spinal injury, if they're unconscious, if they are showing some sort of weakness or numbness or difficulty speaking, if they've had a seizure for the first time or prolonged seizures or repeated seizures or a severe allergic reaction or anaphylactic shock, then absolutely please call an ambulance. For some of the other more minor injuries, like if somebody's cut their finger off or something, actually calling an ambulance is using them a bit like a taxi. There's nothing that you can't sort out with basic first aid and then get yourself to the hospital or to the minor injury surgery or centre in order to be patched up. So the ambulances are really struggling. If we can all do our bit to help, then that will make a big difference. The other time you might need an ambulance is if you've got someone with severe burns. So not a minor burn, but severe burns. For the rest of it, first aid and understanding how to give appropriate first aid will mean that you can prevent minor injuries becoming major ones. You may not even need hospital treatment at all, and you can know enough to save someone's life. Okay, so whilst you're waiting for the ambulance to arrive, key thing, sounds obvious, not so easy, is stay calm. So the calmer you are and the calmer the casualty is, if they're conscious, will make a major difference. And again, if you're feeling panicky, that panic will spread throughout anyone else that is around. So do your best to just calm yourself down. It'll help you think clearer as well. Bleeding and breathing are priorities. If your casualty is conscious, priority to make sure that you are controlling any severe bleeds and you are ensuring that they are breathing normally. If they are having any form of difficulty breathing, upright is the best position. It allows your lungs to expand. If they are, you think, having some form of an asthma attack, help them to administer their own medication. If they're having an acute allergic reaction, then obviously, again, if they have an EpiPen, you would help them to administer that. And if you think they're having angina, again, they may well have been prescribed a GTN spray or tablets that they would put under their tongue. And if that doesn't work, then you would be sitting them in their W position. And if they've been prescribed a 300 milligram aspirin, then you would be considering that they might be having a heart attack. Always keep your casualties warm and dry and protected from the elements. Only move them if absolutely necessary. And really important to understand the key things. So for a heart attack, you sit them in a lazy W position. So upright, knees bent up, and give them their GTN or aspirin if they've been prescribed it. Otherwise, just calm, and you're going to have to wait for an ambulance and be ready to give CPR if necessary. So sit them down on the floor so that if they do collapse, you're in a position where you can easily give them CPR. If you know there's a defibrillator nearby, then ask someone to go and get it so that you've got it nearby should you need it. If you think somebody is experiencing a stroke, you're going to test the FAST. So face, look at their face. Is there a weakness down one side? Is there anything obvious that you can see? Test with their arms. Is one arm going down? Get them to speak. Is their speech slurred? If they smile, is one side drooped? And time is of the essence. So if you don't think you're going to get an ambulance quickly, you may well be better off to get them to the hospital yourself, but only if you feel safe and calm enough to do that, and if they are still conscious and able to mobilise to get them due to the car, and it's not too far to get there. But if you can get somebody who has having a stroke and who's having a stroke which is caused by a blood clot, then getting them to the hospital in that first vital time can mean that they can administer a blood clot busting drug which can reverse the damage. So it's important to recognise and get them to hospital quickly. If you think that they have experienced a spinal injury, if they are conscious, keep them still. So explain to them the importance of not twisting, because you don't want, if there's bony damage, you don't want to have that vulnerable spinal cord getting damaged. If their airway is in danger at any point, they're losing consciousness, they are feeling sick, and you are worried that they're not going to be able to clear their own airway, then you will need to ideally get some other people and log roll them into the recovery position. Otherwise, supporting their head and neck as you go over, you would very carefully put them into the recovery position. Or there's another recovery position that where they support their head like this. It's all on my site. It will explain it to you, where you can roll them into the recovery position, minimizing any twist. If they lose consciousness and they're not breathing, you would need to start CPR. Any possible spinal injury is irrelevant at this point. You are saving their life. So if somebody is unconscious and they are breathing, then you would be rolling them into the recovery position. You'll be putting them into a position where the contents of their stomach and their tongue will flop forward and their airway will stay clear. And the most important thing when you've put someone into the recovery position is use the back of your hand and you keep checking that they're breathing. So you put that under their mouth and nose so that you can feel that they are breathing. Really, really important that when you've put them in the recovery position, it is not job done. You must keep checking that they're breathing, because if they stop breathing, which they might, you need to roll them onto their back and to start CPR straight away and use a defibrillator as soon as possible. I really hope you won't have to use any of these skills. If you do, we're here to help. Please have a good look at the resources that we've got on First Aid for Life and onlinefirstaid.com. Have a look in advance. Make sure you are up to speed. Unfortunately, our NHS is really struggling at the moment and we're going to have to be more self-reliant. Thank you for listening, and I really hope this has been helpful.